All right. Hello, everyone. Thank you for joining me today as part of the Health System Impact Seminar series. I'll be giving a presentation on just building health equity capacity in cancer care systems as a postdoctoral fellow. Um, Slide change. To start, I live and work on Treaty 6 territories, the traditional lands of the Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux peoples. Um, I love I love this land. I love the seasons. You'll catch me outside with my daughter, my dog, any time of the year. And before I get into the presentation, I just want to share a little bit about how I got to be here in the Health System Impact Program. Um, so prior to this work, I worked for 8 years as a registered nurse on a trauma ward. And as a nurse, I always wanted to be part of the decision making and the discussions around health system improvement. So I decided to pursue graduate studies, and I completed my PhD in 2023 with the Faculty of Nursing at the University of Alberta. And while doing my postdoc work, I explored nursing practices and assumptions underlying patient and family-centered care policy in hospital settings. And interestingly, one of my findings in doing this work was that patients and providers often experienced racialization, and this impacted the ways in which they were involved in their care. This work made me think deeply about the non-neutrality often of hospitals care settings, and also the precarious conditions that patients are in due to the social conditions around them. And my interests thus led me to pursuing a postdoctoral fellowship with Cancer Care Alberta to build health equity in the cancer care system. To start a little bit about Cancer Care Alberta is that it's a provincial health corporation mandated to deliver safe, high quality cancer care to approximately 5 million people in Alberta. And in addition to organizing and providing care, they support cancer research. They have data analytics teams, partnerships with many other researchers, and they're very interested in generating and implementing research to manage the increasing demands of cancer care. But they also want to innovate cancer care. So they sought to partner with academic researchers and also community collaborators to explore how research can inform more equitable cancer care, and addressing inequities in cancer care and outcomes was identified as a priority area in their 2024-2028 strategic plan. So within Cancer Care Alberta, I'm supervised, and I'd like to add supported by Dr. Paula Robson and also Dr. Anna Pajadas-Bote. And then at the University of Alberta, within the Faculty of Nursing, my academic supervisor is Dr. Ana Santos Salas, who has a strong program of research on advancing health equity in cancer care. Um, so this presentation is titled Building Health Equity Capacity in Cancer Care Systems. And over the remainder of the presentation, I'm going to share some research projects I've been involved in over the past year to help build health equity capacity. And as I share these, I'd like for you to think about the possible impact um, research projects that involve knowledge synthesis, community partnership, and even original research have towards building health equity capacity. And so to start, one way to build health equity capacity is through knowledge synthesis. And so a key project for my health equity, for my postdoctoral fellowship, was to conduct a scoping review. And so the goal of the scoping review was to summarize the literature reporting racial disparities and also to identify factors affecting racial disparities. This review provides opportunity to identify gaps in the literature and also recommendations for future research. A key challenge for me in doing this review was that the communities that I was interested in gathering information on racial disparities are often not labeled in the way that I'd like them to be labeled. So as racialized or as ethnically minoritized. And that was a challenge. And I don't want to go too much into the findings, but this review did suggest that, racial disparities exist in Canadian cancer care, particularly in areas of cancer screening where there were lower participation rates of racialized groups And there's also evidence in areas of cancer diagnosis and cancer treatment where some groups have later stage diagnosis at like a more advanced cancer stage. Earlier at age, sometimes for diagnosis that was outside parameters that are recommended for cancer screening, higher incidence and lower survivability with specific cancer. And this research resonated. What I found was with other studies in Western countries that indicate that there are adverse differences in the cancer burden that racial and ethnically minoritized groups experience. And so I think knowledge synthesis is a great way to inform policy. It's hard to do. Like I said, people are not often categorized in the way we want them to be when doing knowledge synthesis. At least that's what was my experience. I think the findings of the review will be useful for CCA in regards to how they can think of which areas to address racial disparities. And I think about the possible impact, a scoping review has in reaching a wider audience. The first thing that comes to mind is, a manuscript. It's a great output. A lot of people can read it. Another impact I personally had was I got to share the findings at a national conference organized by the Canadian Cancer Research Alliance in November. And I think the impact for me there was just connection and conversation with like-minded researchers who also have a goal to advance health equity. I had the opportunity in doing this scoping review not to work alone. I was able to mentor, sorry, an honors undergrad nursing student. This is Wanya, in the bottom right of the slide. She went on to share her experience participating in this scoping review at the Canadian Association of Nurses in Oncology, and I'm really proud of her. She received an award. The second strategy I'd like to highlight to build health equity capacity is community partnership. So on September 22nd and 23rd, Dr. Ana Santos Salas, Dr. Ana Pajadas Bote, and I co-led a community-based health equity workshop. This workshop was again in partnership with Cancer Care Alberta. And to support this work, we also had funding from Alberta Cancer Foundation and CIHR. And the goal of the workshop was to identify and prioritize patient-oriented research priorities to advance health equity in cancer care. And we did this by following patient-oriented principles. The workshop was really amazing. It brought together 43 participants. We had patients and community members from diverse backgrounds, health system leaders, and academic partners from CCA, Faculty of Nursing, and everyone participated in discussion. And we attempted to create an inclusive environment and invite communities and individuals that are often underserved and overlooked in cancer research. So this includes gender diverse, racialized, and even people living with cancer or having cancer experience in rural communities. And this workshop was organized around 3 thematic areas: addressing social determinants of health, ensuring equitable access to high quality care, and advancing equitable access to cancer research. So these topics for our workshop were informed by an established health equity framework, but then also the workshop was molded by a lot of by our patient partners as well. And this is a picture of our attendees and what the workshop looked like. And at the workshop, participants were also invited to share personal experiences and reflect on diverse perspectives that were shared by other attendees on their cancer experience. Some of the key insights from this workshop that were brought forward was that to build health equity, we really need to pay attention to income, geography, and finances. Those were areas of focus that participants would like researchers to look at. We also talked about challenges accessing timely care and fear of discrimination. Participants also shared insights related to researchers and having more meaningful research and having funding structures be more accountable and transparent in their practices, and to commit to establishing relationships that are lasting with diverse communities. And the goal is to use the insights that we have. We're going to refine some of the discussions and the areas of focus that were identified during our discussions into creating and developing a patient-oriented equity in cancer research addenda. And this slide here has an image that was created by a graphic artist. So it's called a graphic recording. And they artistically put together all the conversations we had over the 2 days. And I think the impact here with this workshop was collaboration, connection, in a way that traditional research methods don't often allow. So there was a lot of emphasis for informal conversation, and making sure we tried to create a safe space. Because to build health equity means to also recognize there's a history of why inequities and disparities exist. And yeah, it's great. And I would talk more about it, but we don't have much time. And so the final approach to building health equity that I'd like to highlight today is I'm going to spotlight some original research that we're doing. So during this fellowship, I'm working on a project that's funded by the Canadian Cancer Society, and it's titled Increasing Equity and Access to Cancer Care for Racialized Populations of Latin American, South Asian, and Black African Descent. The overarching objective of the study is to co-design a community-based patient and family caregiver navigation program to increase equity and access to cancer care across the continuum for peoples of Latin American, South Asian, and Black African descent. So this project is interesting because it builds on Dr. Ana Santos Salas's research with Black African and Latin American communities, and again, a partnership with Cancer Care Alberta stakeholders. And so we expanded this scope to also include South Asian peoples. Part of that is because that's my personal interest as a South Asian Punjabi woman in Alberta, but we also have other community collaborators that would like to participate in this research. So interestingly, these population groups actually make up around 46.7% of racialized communities in Alberta. So again, I think there's going to be a big impact. Um, this study, what's also really innovative about it is that's co-designed with 7 patient partners. And I don't mean like, oh, now we're bringing in patient partners. Actually, 7 patient partners were involved in designing the proposal, the original proposal. And these patient partners are cancer survivors, caregivers, and community members. And I've really enjoyed working with patient partners. They're it's a little different than working with system stakeholders and other academic researchers. Our interests are aligned, but they bring up really critical insights of how and why we're engaging these communities. Um, and so 3 of them are also patient navigators, and they also have membership in our communities of interest. So they're Black African, Latin American, and South Asian. And they oversee every step. So from the proposal to also right now, as we're doing recruitment, they're heavily involved. And there's many stages in this project, but I don't have enough time to describe the whole scope. I more so just wanted to highlight that it's original research. We're following a patient-oriented framework and a community-based participatory research design. And like the first step with this project is to identify priorities and actions to improve equity and access to cancer care. So we're partnering with local community organizations and Edmonton Third Space Playback Team. So this spring, we're hosting 3 community engagement sessions to help envision priorities. Uh, Playback theater is a way to facilitate community engagement. It empowers and gives voice to communities experiencing oppression who are often overlooked and ignored. It's an improvised form of theater-based sharing of personal stories so that audience members can share, and then in turn, the actors reciprocate, or the playback actors reciprocate the story in theater-like artistic performances with the music involved, metaphor and movement. And so these are going to be taking place in April and March. It's the first time I've ever done anything like this. So uh, I'm not going to lie, it's daunting. I learned a lot from the workshop too, that, as a researcher, you have your objectives, but I forgot actually about the sensitive nature of this topic. So, um, like I forgot to have like Kleenex boxes at the tables, for example, at the workshop. And so now I know going into having community engagement this time that I almost need to, as a researcher, remember that like we have our objectives, but we also have to remember the humans and the nature of the conversations we're having, um, to be sensitive around them. And what does that look materially? So like Kleenex boxes, uh, support after the event to for like access to a mental health therapist. Uh, these are just some examples of things I learned. And sort of to end this presentation, I just wanted to pose a question and feel free if you'd like to answer this question in the chat. You don't have to. I'll share my response. If there is an approach that you think would have been that is the most impactful towards building health equity capacity, and um, Harkeert, prior to doing her postdoc, would have said original research. It's innovative, it's answers a direct question that you pose, and but now the more that I think about it, it really is impact is should be sort of is tied closely to partnership and collaboration. So without having system stakeholders, without having community partnership across all three of these projects, I don't think the impact would be there uh, as strongly, at least. So um, lessons learned to do build health equity, you need trust, you need collaboration. We're not going to solve anything overnight, or even with these three projects. We need long-term partnerships. So thank you all for listening. And